Inhalers are actually the best when used the earliest. Till today, people think asthma is not a disease, it is some infection. People don't go logical, they go more social. Log kya kahenge? Asthma is a disease, it is not an infection or an allergy. Asthma does not mean inhalers, and only inhalers does not mean asthma.
There are 250 million asthmatic patients in the world today, and out of that, 34.3 million people are in India alone. To add to it, India alone accounts for 42% of global deaths due to asthma. On the occasion of World Asthma Day, we have Dr. Gawande with us. Thank you, Dr. Gawande, for joining us today. I'd love to start by asking you that being a pulmonologist, what does this day mean for you, and why do you think we should consider this day as one of the important days in our calendar?
World Asthma Day is important to us for two reasons. Number one being that asthma is one of the most grave diseases that we have in our country. Unfortunately, is not a lot is talked about it, but it is one of the largest or the silent killers of our country. Number two is that asthma can be in your family, in your population, in your community, and you may not know about it. So it goes undiagnosed so much that you are around asthma but you don't know about it, and that is why being checked for asthma is a very important deal for us. And that's why this day could be a day where it can be a reminder for everybody that asthma is not some small illness that comes and goes. It is a big problem for the country, and we have to deal with it.
Absolutely, absolutely. So, what do you think should be a good initiative or a good thing that they can do to keep themselves aware that they're suffering from any underlying condition or symptoms?
See, there are two aspects to this. Aspect number one is we have to first turn the barrier of social impact of this disease, number one. Then comes the second barrier where you're not diagnosed at all. Most patients don't feel they need to be diagnosed for a lung disease, because apparently lung has not been a big organ in the last decade, but in the coming years it is now very evident for everybody that lung has a very important function in the body.
Yeah.
And if your lungs are going bad, your whole body is going bad.
Yeah.
And the best way to diagnose it is a simple test called a PFT. It's a pulmonary function test or a lung function test,
Okay.
which happens in most labs today. Health packages that you do every year, PFT should be a compulsion in these packages. From in the next coming years, that's going to happen, because that will give us a very good insight about a patient, if he's asthmatic, if he can be an asthmatic, or even other diseases like COPD, for example. There is something called as pre-asthmatic, there is something called as pre-COPD, which can be diagnosed only by this small test. So that's important to know that we should all do those tests every year.
This is really eye-opening, doctor. This perfectly sets the stage for our today's theme, which is making inhaled treatments accessible for all. As a healthcare practitioner, what does this theme mean for you?
Inhalers are always available in the world. It's not that they are not available. They're there everywhere. And today, at least, we can find them in every nook and corner of the country. The question is not availability. The question is about a patient's or a person's ability or a person's acceptance to use them. Till today, unfortunately, inhalers are still the stigma कि ये मुझे use नहीं करना है, ये बहुत ज़्यादा heavy है मेरे लिए, या फिर मुझे इसकी आदत लग जाएगी, या फिर मुझे ज़रूरत है क्या. So till today people think asthma is not a disease, it is some infection that मुझे अभी आया है, मैं 4 दिन पंप लूँगा फिर छोड़ दूँगा because फिर मुझे ज़रूरत नहीं है. Or it is like अगर I am breathless, I will take it. If I am not, I will not take it. So I think the idea of inhalers being available everywhere is not the question. The question is people being accepting of using them. Even today, I get patients who come to the hospital and are breathless, and we give them an inhaler and they're like, एक दिन यूज करना है ना, या 4 दिन के बाद छोड़ दूं चलेगा, या इसको लेना जरूरी है, कोई गोली तो नहीं है. No, they have these questions which are completely irrelevant, but because of the stigma of that one small device that we have.
Why do you think that many people see inhalers as a last resort?
That's the mindset is started because of the fact that people are scared of the word inhaler. Okay. Like I'll give you a nice funny story. I had a patient, 50-year-old guy, who was diagnosed with liver cancer. So he went through a liver transplant. And it was a humongous effort. We had a whole month. I was the pulmonologist taking care of the lung part of it, because lung also gets affected during these transplants. So he was doing great, but at the end his lung became a little inflamed post the transplant. and he was doing well, he was fine, but he was a little breathless. Okay, so we suggested that you take this inhaler, and suddenly this person became very defensive. कि sir लेना जरूरी है, नहीं लिया तो नहीं चलेगा. And in my head I was like, you just went through a transplant, and inhaler is your problem. So in my head that was funny, but for him it was a problem. He was okay with doing a liver transplant. He was okay with taking around 20 tablets a day. But just when I gave him an inhaler, he suddenly is like, no sir, are you sure? Can we change this? So I think it is the mindset that has to change, and not the device per se. The devices are there everywhere. If your mindset changes towards that device, that it is nothing big, then it matters. Like for example, I always tell my patients that one of the biggest problems they have is, one, it is embarrassing to have a device in their hand, and number two is they feel that it is going to be addictive. To be very clear with all the patients, they are not addictive. You can lose them if you do everything right, and they cannot always be embarrassing. And you always had these L-shaped devices, but there are so many new devices come up. There are so many different types of devices that if you have it in your pocket, nobody will even know that this is an inhaler. There are so many new devices coming up. So that embarrassing factor also goes away the moment you accept the fact that you have a problem, and you have to take a medication for it. And the medication comes in a L-shaped format and not in a pill format. That's all there is.
So I would like to know, doctor, that why isn't this the perception for other ailments? Like जैसे आपने कहा कि लोग सोचते हैं कि मैं डिपेंडेंट हो जाऊंगा या मुझे एडिक्शन हो जाएगा अगर मैं इनहेलर लेता हूँ, या कोई डिवाइस पे मैं डिपेंडेंट हो जाऊंगा रादर देन पिल्स. बट लोग चश्मे भी तो पहनते हैं अगर उनको आईसाइट का प्रॉब्लम है. तो उसमें लोग क्यों नहीं सोचते कि मैं चश्मे पे डिपेंडेंट हो जाऊंगा, या उसमें वैसा माइंडसेट नहीं है. बट व्हेन इट कम्स टू इनहेलर्स, लाइक यू मेंशनड इन द केस ऑफ अ लिवर ट्रांसप्लांट पेशेंट, दैट वाज अ बिगर कंसर्न फॉर हिम rather than getting the liver transplant, but that we do not see for other ailments or other conditions that people are suffering from. जैसे मैंने spectacles का example दिया. So why do you think this is the case for a category as serious as respiratory, because lungs is one of the most vital organs in our body?
So I think it is social stigma. We as a society have made this belief that wearing or using an inhaler is a bad thing. But social stigmas are unfortunately very difficult to remove. Like there are many social stigmas. Like there is no stigma on wearing specs.
Right.
But if you have a balding hairline, it is a stigma. If I tell somebody, you know what, just become bald, just shave your head off. No, they will not do it because it is stigma. वो ही चार बाल घुमाते रहेंगे पर वो काटेंगे नहीं, because stigma आ जाता है एक. Again, these are all, unfortunately, it is a cultural thing and less of a medical thing. Our culture does not allow us to do that for some reason. Okay, thankfully in urban areas that is changing a lot, but still in rural areas that is still the question here. And I feel over time this is changing, not the best speed for me, but I would say it is changing. In urban areas we are not shying away from inhalers anymore. At least I have to convince them sometimes. It takes me around 10 minutes to convince a person to take it. Sometimes it's a 50-50 thing now. 50% I don't need to convince, they just take it. 50% I need to convince them a little bit, but they do get convinced, thankfully. So we have to spend a little extra time on that part of it. Unfortunately, why the stigma started is something that even I want to know. Even I don't know why an inhaler stigma started. But in either ways, we've seen that many people have accepted asthma as a disease, even socially, or even we have celebrities who have accepted this disease on their own, which is going to help us, improve this social stigma, or rather get rid of it.
So do you think this has to do a lot with the social awareness? What do you have to say to that?
For the youth or the public to understand that inhalers are not bad for you, are great for you. Like inhaler is one of the very few drugs or treatments that have minimalistic side effects.
Okay.
Most drugs, every drug you take has some side effect, and there is a list on it. If you go Google it, Google the list of side effects of any drug that you have. Be it diabetes, be it heart, there is always a list. There is always around 5 to 10 things that are side effects. Okay, list an inhaler and see what side effects they have. You'll hardly see 3-4 things there, and that too very minimalistic. So unfortunately, people should know that. People should know that inhalers are the most easiest things to take. People don't go logical, they go more social. Stigma, लोग क्या कहेंगे, perception क्या है इसका, inhalers कैसे use होता है और क्यों होता है. They think using an inhaler is like the end of the world.
I think this is really eye-opening, because I also personally did not know that inhalers have the least side effects amongst all the medicines. So this is really, I think our viewers would also be surprised to know. Now let's dwell into the word accessible. What do you think are the real barriers patients face in India? Why do you think that inhalers are not that widely accessible in India?
If you're talking about accessibility in remote areas, for example, geographically, then sure, there are certain areas that we unfortunately don't have access to inhalers, and I would not say inhalers, but the proper kind of inhalers. So most of these areas have these very typical standard inhalers which they use for every person. Unfortunately, that's not the case. Today, inhalers are so vastly differentiated. There are so many types of inhalers, so many drugs that are used in those inhalers. So those specific drugs that are newer drugs that are much better use, minimal side effects that I was talking about, are may not be available in smaller centers, for example, but it can still be made available. Second, accessibility would be also to a specialist. Like there are certain types of drugs that you would probably only a specialist will write to you, a pulmonologist. But we don't have a pulmonologist in every part of the country today, unfortunately, yet.
Yeah.
So again, accessibility towards knowledge of what to give could be a barrier there. So unfortunately, that is not on the population, but that is on us, because we are not there available to tell them exactly what they need. Number three in accessibility would be the fact that most patients may have it but not use it. So
Okay.
accessibility in that sense, again, socially speaking, many patients I do get who I write an inhaler, they use it for 4 days, maybe 10 days, and then they stop because now they don't have a symptom.
Okay.
So this one thing that I always try to explain to my patients, ki asthma is a disease. It is not an infection or a allergy. It's a disease, just like your blood pressure is a disease, just like your diabetes is a disease, just like your thyroid is a disease. But you don't stop taking diabetes medications, right? You don't stop taking blood pressure medications. If tomorrow your blood pressure in the morning is perfect, 120/80, do you stop taking medications?
No,
You
absolutely
keep
not.
continuing.
Yeah.
But why do you stop taking them when your asthma, your breathlessness is gone? So that is something that, again, a mindset to change, that just because a symptom is not there does not mean the disease is not there. The disease is there in your body. If you do not keep it under check, it will go bad.
Yeah.
And that is the reason, that is big reason that when you said 50% of deaths in asthma happen in our country, is one of the big reasons this. We stop treatment. We are not great at continuing asthma treatment.
So basically, adherence and discipline to the therapy
Is very bad.
Very bad. So what do you think, doctor? How can we improve this? Like, how can healthcare companies, like, if there are any digital tools that can help increase the discipline and adherence of patients to the use of inhalers? Do you think, because now the digital penetration is very high in India. So, what do you think companies like pharma companies or healthcare companies can take initiatives and help these patients to adhere to the medication, adhere to the therapy?
Right. So there are many digital programs now. Even Cipla has one digital program, which do help in making the patient, first of all, easily accessible to drugs, which they can easily take. There are people who are helping them to find their proper inhalers if they can't find it around. And number two is the programs also help the asthmatics to realize that taking drugs every day, what will it do to you, how will your future look like. Number three is, or another very important aspect is, which I always tell most of my patients, is that asthma does not mean inhalers, and only inhalers does not mean asthma. So it is not just taking an inhaler will suddenly make your life great.
Okay.
It is just a part of the treatment. There are many aspects to an asthmatic or to any other lung diseases, and every aspect should be fulfilled.
Okay.
And these digital platforms usually help in fulfilling the other aspects of asthmatics or even other lung diseases like COPD also.
Okay.
So that helps them to keep as a reminder, as a check, or as an alarm system to use when they forget to use their pump or they forget to do something else. So that can be used as a reminder, number one. Can be used as a fact that other programs that are very much important, like for example pulmonary rehabilitation,
Okay.
a very important program in
Yeah.
lung healthcare,
Yeah.
which has to be done, which most patients avoid or ignore. And these digital programs which are started for inhalers can also be used to help people understand asthma, and so that they can understand the importance of other treatment plans that we have for them.
So when you mention other aspects beside inhaler, like you mentioned about the pulmonary rehab. Are you trying to indicate about the diet or the lifestyle habits, lifestyle choices, breathing exercises, physiotherapy that people should follow besides the medication or the inhalers that they use? Can you elaborate further on this?
Okay, so there are ideally four categories or four plan, a 4-point plan that we have. Okay, plan number one is obviously medications, and medications, they come to inhalers, they come to tablets, everything that is included, right? Whatever your pulmonologist is suggesting to you. Plan number two is to check for comorbidities. That means not every asthmatic is only going to be an asthmatic. He might have a heart disease, he might have a kidney issue, he might have thyroid, he might have diabetes. So keep a check. Number three is a part what we call as lifestyle. Lifestyle, what that means is that what are you eating? What are you doing during the day? All of this matters because asthmatics don't want to sit with a pump 4 times a day, right? Most asthmatics don't want to use their pump 4 times a day.
Right.
So then what do you do for that? Medication is not the only answer. The answer is fourfold. Medication is part of it. Lifestyle is part of it. When you say lifestyle, then there is one. Number one is diet, right? Diet, what do we eat? So what is asthma generally? If I just forget all of it, in simple terms, what is asthma? Asthma is inflammation in your lungs.
Right.
I'll just keep it very in a simple language if I have to say, right? It is inflammation in your lung. Now what is inflammation in simpler terms? जब हम गिर जाते हैं कभी और हमारा घुटना सूज जाता है, गिर गए, कट नहीं है बट सूजा हुआ है, तो लाल हो चुका है, राइट? अभी इसको बोलते हैं इन्फ्लेमेशन. अभी अगर इसके ऊपर मेरा दोस्त आके हल्का टच करके जाता है तो क्या होगा?
बहुत दर्द होगा,
राइट? सो इमेजिन एयर इज गोइंग थ्रू दैट इन्फ्लेमेशन एवरी डे. दर्द तो है, राइट? एंड इट इज पेनफुल फॉर द लंग बिकॉज लंग में, क्योंकि हमारे लंग्स में नर्व्स नहीं होते तो हमें महसूस नहीं होता है, but actually it is painful for the lung. Every time there is a air gush of air going in and coming out, it is painful for the lung because the lung is inflamed, सूजा हुआ है.
Okay.
तो अगर कुछ शरीर के अंदर का ऑर्गन सूजा हुआ है तो what do we do? Simple logic is सूजन कम करना है, correct? So inflammation को कम करना है तो we have to give you anti-inflammatories,
Right.
okay? And there's another aspect called lung architecture. आपका जो लंग का जो आर्किटेक्चर है वो ओवर टाइम खराब होने लगता है in asthmatics or even in COPDs. So architecture कैसे बचा के रखें? उसके लिए we need some other medications or other enzymes called antioxidants. Both help in improving the lung. So that is where the diet plan comes in. You have to have diet which is a good anti-inflammatory and which is a good antioxidant. And also lung is made of protein. अगर प्रोटीन का बना है तो आपको प्रोटीन की ज़रूरत है क्योंकि जिस चीज़ का बना है उसकी ज़रूरत है. तो ये तीन चीज़ आपके लिए बहुत इंपॉर्टेंट है. अभी एंटीऑक्सीडेंट तो बहुत आता है, जैसे ऑल योर बेरीज आर एंटीऑक्सीडेंट्स, योर ब्लूबेरीज, क्रैनबेरीज, अदर बेरीज, राइट? एंटीऑक्सीडेंट्स. इवन योर फ्लैक्स सीड्स, योर चिया सीड्स are antioxidants, for example. There is a long list. You can always Google those lists. Anti-inflammatories, a lot of vegetables, fruits, nuts are anti-inflammatories. Apples, oranges, heavy vitamin C medications are all anti-inflammatories. Like हमारे बचपन में दादी बोलती थी कि हल्दी का पानी पियो या फिर हल्दी में जिंजर डालो, गार्लिक डालो और पानी पियो रोज सुबह गरम हल्का वार्म.
Right.
Not a wrong thing. It's actually helpful because all these aspects, ginger, garlic and turmeric, are anti-inflammatory. So what they're trying to tell you is that if there is any inflammation in the body, it will get better over time. So again, very good thing to do. Most of these patients, I always tell my patients to have raw garlic because raw garlic is a great anti-inflammatory, even raw ginger for that matter.
Right.
So there are many such things that can be used in your everyday life and help you in getting better in the inflammation part, in the diet part. Then comes your lifestyle. Exercise, very important. Again, a big myth. They say मुझे अस्थमा है मैं दौड़ूंगा नहीं, मुझे अस्थमा है मैं वर्कआउट नहीं करूंगा, मुझे अस्थमा है मैं ये नहीं करूंगा. बिल्कुल नहीं. That's absolutely a myth. I urge all my asthmatics to go do something, do physical exercise. You need to pant. It is like अगर आपके पास बुलेट बाइक होगा घर में, कभी चलाया होगा बाइक,
Right. Yeah.
अगर मैं बोलूँ बाइक को आप रखो 2 साल के बाद निकालो तो चलेगा?
नहीं चलेगा, मेंटेनेंस की जरूरत.
That is what lung is also. Every organ is like that. If you keep on moving it, it will work great. If you keep on making it sit at one place because you're scared इसको कुछ हो जाएगा, it is going to get worse for sure. So don't keep it is a machine, don't keep it sitting. Keep it working, keep it oiling. That is when it will work beautifully. So if you're an asthmatic, doesn't matter. Run, walk, whatever you can do. It will definitely help you. Like many of the times the big question is, sir, क्या करूँ? करूँ क्या मैं? बेसिकली करूँ क्या जो सेफ है मेरे लिए? ऐसा कुछ होता नहीं है फर्स्ट ऑफ ऑल कि सेफ है. आप जो भी कर सकते हो करो, आपको जो पसंद है करो. बिकॉज आई ऑलवेज टेल माई पेशेंट्स, आई डोंट गिव देम एन आंसर कि आप ये ही करो. नहीं, आपको जो पसंद है वो करो फिजिकली. बिकॉज इफ ही डज समथिंग ही लाइक्स, he will keep on doing it. नहीं तो we will not do it for a long time. So आपको cycling पसंद है करो, आपको walking पसंद है करो. So one of the best exercises for asthmatics is actually swimming.
Yeah.
Swimming really helps, one, to keep your body fat index better. Number two, improves your stamina. So your lung capacity improves over time. So great. But if you don't like it, it's fine. You can do brisk walking, you can do cycling, jogging, completely your call, whatever you prefer to do. But anything that it should pant you, it should make you sweat.
Basically, have an active lifestyle.
Correct.
Yeah.
I always say 1 hour a day, 1 to 1.5 hours a day, you have to do something physical. Then that is your lifestyle part. Then comes your immunizations. That is to keep yourself safe from other infections. That's when your immunization for pneumonia, for flu, for herpes zoster, there are many vaccinations that come up. I always urge all my patients to take these vaccines. So that is how the four-fold system will work if you have to be a completely stress-free asthmatic.
That is beautiful, doctor. You have really beautifully explained it. And also, like you were saying, that active lifestyle is something that you really recommend to your patients. I think this has been endorsed by sports persons also, like David Beckham, who has come out openly that he has asthma, and our very own badminton superstar Parupalli Kashyap. So now these celebrities are also coming out and telling that they have asthma, and they have been really successful and have been high achievers in their life. So I think the mindset is shifting, and with interventions from healthcare companies and government and the society at large, I think we have come a long way from where we were. क्या आपको लगता है कि income या finances impede करते हैं patients को from taking respiratory treatment for the respiratory ailments?
I feel not anymore. It was maybe around 5-8 years back, but today I don't think so, because today, two reasons. One, thankfully, because the use of inhalers has increased over time by patients, so inhalers have become a little cheaper. And number two, pharma companies have a lot of programs, those 2+1, 1+1 programs where they give it cheaper on a much discounted rate. So that also helps. So accessibility and money strength or financial strength is not, I think, a big factor. Again, that could be a subjective call for every person, but I feel if you're an asthmatic, you can do well with around $1,500 a month or something, or around 2,000 rupees a month, and you can do well with most of the inhalers in a general setting, unless there is something specific happening. But generally, I think you can do well, and I think that's affordable for most people around.
So I think, so what you're saying is basically accessibility will not be hindered because it's a very affordable treatment, and people can at large afford treatment for respiratory ailments.
When we have an asthma attack in any individual, okay, so that is a very important factor to understand, what most of the patients or people don't realize. Number one is that asthma attack, in many cases, not in all, but in many cases, is always a 60-40 split. Okay, so 40 to 50% is an asthma attack per se, and the rest 50% is a lot of panic. And it's fair, because if you can't breathe, you're going to panic, right?
Yeah.
But panic creates you to become, or makes you more breathless, and that is another unfortunate fact also. So if that is the case, and that happens most of the time with us, that's when we have to tell reassure our patient that to relax, calm themselves down, okay, and not to get very frantic. And because one problem is, patients get frantic with using of inhalers at that point. For example, I had this patient, she was a 30-year-old lady who got her first asthma attack. And because it was the first, she got very frantic, or she panicked. And on that panic, she was having the attack from morning till evening. And in a matter of 10 to 12 hours, she finished 2 inhaler bottles. Just kept on taking inhalers without any regard to whatever is happening to her. And that's one of the reasons where I say that panic sets in, and then patients do a lot of crazy things.
Yeah.
So, and eventually she came to the hospital, and she got settled. Now, that's the reason I said ki, panic is a very important factor in asthmatics, and that is where there is always a 4-4-4 rule. It's a 4-4-4 rule. We always tell our patients, if you get an asthma attack anytime during the day, number one is take your inhaler, one puff, and take 4 deep breaths inside, and then wait for 4 minutes. So that is 1-4-4-4. Do this 3 or 4 times. If that does not help you, that's the point where you have to end up going to a hospital. That is a basic rule that all asthmatics should remember. It is a 4-4-4 rule. If that does not help you, then you go to the hospital. But in many cases, I've seen that once I've explained that to the patient, ki calm yourself down, take one puff, take 4 breaths, wait for 4 minutes. As the more they are calm, the much faster they recover. That is one of the thing. Another very funny patient we saw, that there's this man who came to us with an asthma attack. He was an asthmatic. He said, I have an asthma attack. He came to my clinic actually, not even the hospital. And when I spoke to him for 5 minutes, I just tried to distract him from his asthma attack. We just spoke about random things, and within a matter of around 10 minutes of speaking to him, his attack also went away. He had no attack. He had nothing. So most likely in his case, it was more of 90-10. 10% was the attack and 90% was just panic.
So basically, it's also psychological.
Yeah, absolutely. It worsens a problem.
Okay.
Like many times I tell my patient, for example, asthma will never trigger when you're sitting. Okay, if you're sitting in your own home doing nothing, it will never trigger. It is very, very rare for you to have a triggered asthma. But you'll always get a patient, he's saying मैं घर पे बैठा था और मुझे सांस फूल गया और सडनली, या फिर मैं सोया था और सडनली मुझे सांस फूल गया, राइट, तो मैंने 4 बार इनहेलर ले लिया. Now what is that? So that is what we call as a psychological factor towards asthma. The constant scare in your head that I will get an attack now, or I will become breathless. And when you are overthinking about something, that is what we call as anxiety. So the anxiety can make them breathless.
Correct.
So the most common example I give patients is ki just because you're breathless does not mean you have some asthma problem.
Okay.
Like if there is a tiger in front of you right now, will you get breathless? Probably yes.
Yes.
Does that mean you have an asthma?
No.
No. Right? Because you can get breathless from your brain also.
Like you mentioned that not all symptoms means that I have an underlying lung condition like asthma. Can you touch up on those specific symptoms? That will be really informative, I think.
Very important to know, not every breathlessness is an asthmatic. He may be something else. But for asthma symptoms, usually somebody who has recurrent allergies, continuous allergies, might end up becoming what we call as allergic asthmatic. So please make sure that your allergies are well controlled. Now, secondly, if you are breathless during exertion, for example, and if you are breathless because of a certain trigger, like if you go to a dusty place, or if you go to a colder climate, or the climate, if your climate changes in your city, for example, or any particular food that suddenly makes you breathless, then these are also patients who might be asthmatic because of a particular reason. Number 3 is that asthma in many cases can also be genetic. Okay. So if your parents have asthma, please check yourself every time. A young girl comes to me and says कि मम्मी को तो 40 के एज में asthma आया था, तो मुझे 40 तक issue नहीं है.
Okay.
And I have to tell them, no, that is not the case.
Okay.
When the asthma triggers in your body has nothing to do with what happened to your parents.
Okay.
Just the fact that you have the genetic component to it, so be ready. It can trigger at 10 also, at birth also, and it can trigger at 50 also. Third part is the very early on symptom of asthma, where nobody usually ignores, people ignore them, is chest heaviness.
Okay.
They may not be breathless, but they will always feel this heaviness or tightness in the chest.
Okay.
And during that time, most of them ignore it. Yeah. But we have to make sure that you have to know what is happening and why that is happening. Hence the whole everyday health checkup, every year health checkup, and hence every year PFT. Very, very important. I have assured even my 18-year-old patients, do a PFT. It doesn't matter what age you are, do a PFT. Because I'll tell you a very simple fact, again, not a complete medical fact, but it is a generalization. When a child is born in India, okay, and comes out and goes to his house from the hospital, in one day, he has already taken in 4 cigarette smokes. That is the level of pollution we are at. That is why every person should do a PFT regularly, because if you don't, you will never know when your lung is gone bad.
What is your take on like people not knowing the right way of using an inhaler, and they have been using an inhaler because they have been prescribed one by their doctor?
Yeah.
Like, would you want to like
Oh, that's
shed some light on that?
very, very important. Actually, that's one of the most important things that I have always taken care of with my patients, because most of the time it is not what you're using, it is how you're using it. That is the problem. I have had that problem so many times that a patient comes to me and says, मैं inhaler ले रहा हूँ, मुझे कुछ नहीं हो रहा है, मैं भी breathless हूँ. And I just tell him exactly how to use it, and suddenly within a week he's completely fine. So the way of using an inhaler is very, very important. And for that also, when you have these digital programs, they also help, because nowadays in most of the pharma company boxes, there is a QR code. If you scan the code, most of them will show a small video of how to use an inhaler. Okay, so if you are tech savvy enough, please do that. All boxes have that, most of them have it. So use that QR code and figure out how to use it. If you can't do that, there are hundreds and thousands of YouTube videos of how to use an inhaler and every type of inhaler, and they will always tell you. But to give you a simple rule on how to use it, number one, always sit or stand. Do not lie down and take an inhaler. Okay. Number two is, whenever you're using an inhaler, your chin should be up so that your airway is straight. It should not be down. It should be up as much as it can be. Okay.
Okay.
And when you inhale, it should be a very long and strong inhale. I always tell them long and strong, long and strong. And once you finish your inhale, hold your breath for around 5 seconds and then exhale. That is your general way of using it. But if you don't understand that part also, it's fine, but you can always YouTube it or ask your doctor to show you how to use it. I always show all my new patients how to use an inhaler. We have our mock inhalers in our clinic, so we always tell them how to use it.
If I am an asthmatic patient but I have been diagnosed late, or if I start my treatment late, what do you think will be my real life consequences in such a scenario?
See, I've always said that lung as an organ is a very big organ. Okay, factually. So it's an organ which is, one is this side and one is the other side. It is one of the biggest organs in the body, and that is a good and a bad thing. Good because you have a big organ, you have a lot of room. That if something goes wrong in a certain part of the lung, there is a lot of lung to take care of the rest of the part. To sort of like compensate. But that is also the bad part. The bad part is that if a small percentage of the lung goes bad, you will not notice it, because it is big enough. Unless you are, you're Virat Kohli and you're a gymnast or an athlete of some
Very
kind
fit.
where endurance is a very important factor, then you will probably know. But for everybody else, everyday life, we don't understand if your lung is going bad.
Yeah.
You will only understand when like half the lung is gone bad.
Okay.
That's when you start having a symptom. So that's the bad part, that the lung is big. That's actually the bad part of it. So that is the reason I always keep on urging patients ki you will become an asthmatic or a bronchitic or anything else, or just because of pollution. But you will never know that your lung is gone bad until it has become until a particular percentage of lung is gone. Okay. And another unfortunate factor is that, unfortunately, lung damages are irreversible damages.
Okay.
We cannot get them back. We can probably get them around 10 to 15% back, but that's it. The rest of the lung, if it is damaged, it is damaged for good. Unfortunately, that is the fact. And that is one of the reasons why we urge patients to do PFTs every year. Keep a check on your lung, because if it is gone, unfortunately, you cannot get it back. You cannot make your lung completely whole, perfect again. What we plan to do is the rest of the lung, we keep that lung to be much better functioning, or keep it away from other diseases or whatever is happening in the rest of the lung. So that will be our plan at the end. Okay. So that is very important. Lungs is an irreversible damaged organ. So please use them, or check them regularly.
Also, in today's times, because of the increasing air pollution, the higher AQI levels across the country, in my day-to-day life or in anyone's day-to-day life, how do I ensure that my lungs are not like are less damaged?
So, a couple of things. First of all, understand the mindset of how lung damage works. Okay, or in other ways, compensate on what you cannot control. Right. So, air pollution you cannot control, but you can control what kind of air can go into your system. Use air purifiers at home. If not, masks can be a good option to use if you are a daily commuter, for example. If you commute with public transports, use a mask will definitely help you. Number two is take care of your health. As we spoke about diet, use all of those products or diet properly in your food. And number three, exercise. So there are three factors to anything going bad. Factor number one is you are going towards the bad, right? Like for example, smokers. So obviously get away from the bad habits. Number two, exercise. So what I'm trying to say is compensate. If your lung is going to go bad in a certain area, you try to reverse or improve the rest of the lung functionally by having good diet. Exercise improves your endurances, hence improves your lung capacity. For example, why does a athlete run for 1 hour and not have a problem, but if we run for 10 minutes we are already bad? The reason is not because he has some great genes. No, he's done this for a very long time. So it's repeated things. What do you call it,
Training of lungs
training
basically.
every day is important. Don't expect कि मैंने 4 दिन भागा तो अभी my lungs should be great. No, you have to do it every day. It should be a habit, it should be a lifestyle, it should not be a short term thing, and that will eventually help you. Another 2-3 things are yoga helps you a lot. I have recommended yoga to a lot of my patients because the way you breathe is very important. There is something called as patterns of breathing. So there are patterns of breathing that help you a lot. For example, again, there is this four principle of pattern of breathing. Okay, so what that means is if you are ever that also helps in patients of anxiety, panic, or anything else. If you are ever feeling breathless, take a deep breath for 4 seconds. Hold for 4 seconds, exhale for 4 seconds, and hold again for 4 seconds.
Okay.
So you could call it anything. We used to call it 4x4 method. So that helps you to calm your body, number one. Also helps your lung to fill in enough for the lung to be calm enough. You do not have to fill the lung completely so suddenly, because that also will. So filling a balloon to the extent also is not the best thing when you are in panic or when you are having this attack. So 4-4-4. 4 seconds inhale, 4 seconds hold, 4 seconds exhale, 4 seconds hold. Again 4 seconds inhale. Do this couple of times and you will automatically see that you will calm yourself down. And that helps a lot to most of the patients.
Got it, got it. That is really beautifully explained. Now, doctor, we'll do a rapid fire round with you.
Okay.
And we'll try to bust some myths. It will be really quick, and you can feel free to elaborate on any particular myth if you choose to.
Okay.
Inhalers are addictive.
Oh, not at all. Absolutely not. I have had patients who've taken it for a month and left it. Not addictive at all.
Inhalers are only for severe asthmatic patients.
Oh, no, not at all. Inhalers are actually the best when used the earliest. Then you don't end up becoming a severe asthmatic. That is the contradictory part of it.
Pills are safer and more powerful than inhalers.
There is no such differentiation. Whatever is there in the inhaler is the pill itself. But
Okay.
we are giving it directly to the lung. Why would I give it in your stomach? It's much faster if you're getting it in your lung again directly.
Children should not use inhalers.
Again, not a requirement. I have given inhalers to children. Yes, definitely there are different standards of inhalers for them, but yeah, you can definitely give it to them. Again, as I said, if used early, inhalers are the best way to treat you faster.
Inhalers are expensive.
Not at all. Nowadays, inhalers have become very cheap. Depends on what you're taking, but not at all.
Okay. Inhalers impede your growth,
Of what?
like in your height.
Oh, not at all. Absolutely wrong. So this myth is actually there because many patients think or actually know that there are steroids in inhalers. So they think if I take this for a longer duration of time, it is going to do something bad for me. But to be very precise, the steroids in inhalers are in the most minimalistic format. If you take a tablet of steroid, it is in milligrams, right? 5 milligram, 10 milligram, 20 milligram. But if you take inhalers, please check the box. Their steroids are in micrograms. Number one. Number two, these steroids do not enter your blood system at all. They enter the lung and they only work in the lung. They don't come into your body. So it does not really cause that long-term damage as most people think they are.
Before we close the session, what will be your one big message on the theme of making inhaled treatments accessible?
I think if you want to live a completely normal, happy life as an asthmatic, please don't be scared of inhalers. Use them as required. If you have a problem with accessing them, I would suggest find a specialist who can give you the right treatment, the right location of where to use it and how to use it. If you know the right way of doing things, you will have a great life ahead, as exactly same as any human being in the world.
That's a great message, doctor. It was a pleasure having you on the
Nice talking to
podcast.
you.
So when you breathe easy, you live fully. Let's make that a reality for everyone.